Hi, so my name is Rosmus. I'm a contact lens optician and I wear two hats professionally. So I'm professional affairs and manager for the Body Doctor and also work in clinic fitting contact lenses and running a dry eye clinic simultaneously. I'm going to show you a device today which is great as an in-practice treatment, and it's called NuLids. We're going to go and wash our hands, make sure that our hands are nice and clean up to the wrist, or you can use gloves, whichever is more convenient for you. So here is your NuLids device. I usually demonstrate it on the back of a patient's hand so they know what they're going to be feeling. And here are your biodegradable tips. So one for each eye, and your gel, which is a bit like ultrasound gel, and you put it onto the tip and you can place a little bit onto the eyelid as well. And it just helps the device glide backwards and forwards a little bit more smoothly. They're sitting in their sight testing chair. You want them to sit back, head against the headrest, and you're going to tip the chin up and get them to look down and close their eye. So now we're going to pop it onto his eye and just give very clear instructions about where you want the patient to look and how you want them to look. And you can see that we're now running the NuLids across their lid margins and now through the lashes as well. And very slowly, as we go backwards and forwards, the NuLids is starting to oscillate and really give those glands a good massage. Whenever you're doing a NuLids procedure, please make sure you're continually talking to the patient and telling them that this is working really well and you're liking the way that the glands are being massaged. And especially when you stop to look on the slit lamp, really reinforce the fact that actually everything's looking so much better. So that it's always a conversation and they're never sat in silence. So you do find that as you're using the NuLids and you go along the lid margin, you're going to go backwards and forwards, gently making sure that you massage all the glands and going through the lashes and those lid margins. You will find the machine stops every now and again. That's good and normal and natural because you need to have that little bit of a break. As we then invert the lid slightly, we're going to go along that lid margin, really breaking down the biofilm and those collarettes. So the patient's getting a massage and an exfoliation at exactly the same time. Now that we're happy, we've looked down the slit lamp a couple of times, made sure that we're happy, that we've cleaned away as much as we can. The eye is will probably look a little bit red because we have agitated it a bit, but that's fine because the patient's already starting to feel a lot more comfortable. We just want to clean that area up and we're going to use some wipes to do that. So sometimes what I do advise our patients to do, especially at home before they use the wipes, is just pop it in the fridge for 10 minutes because it's actually nice and cool, and that anti-inflammatory effect of just cooling the skin is actually very comfortable for the patient, so we can do that as just a bit of a tip. Now we've finished the procedure, so we're going to examine on the slit lamp, make sure that we're happy, make sure we've got rid of all the biofilm on the collarettes and the glands are expressing well, that tear prism height has come back to normal, and as long as we're happy, explain that to the patient and repeat the procedure on the second eye. So once you've done both eyes, dispose of both tips, clean down your equipment, wash your hands, or if you're using gloves, dispose of your gloves and make sure you're ready for your next patient.